Welcome back to another week of Podding with PT. I'm Tyler.
And I'm Patrick.
And this week we got our good friend Eric Bialczak coming from Long Island, New York. How's it going, Eric?
Great. Thank you guys for having me. I'm really excited.
Okay. So we've had Eric was one of our, I don't want to say classmates, but was also in the program at Sacred Heart with us. I knew Eric actually, funny enough, he was my RA, sophomore year of college.
Yeah, that's true.
It was funny. I was getting to see Eric go through the process of PT school, and he kind of scared me at first because I think it was the first semester. I was like, "Oh, how did it go?" He was like, "Bro, this shit is terrible." So,
hey, keeping it honest.
Yeah,
that's great.
Talk to us a little bit about your backstory, Eric. Where you at now? What got you into PT, and kind of how your path through that.
Yeah, I do remember that the RA life. It was a good time. I mean, you guys. So I remember your room was just. It was. I always worried whenever I had to go into that room. I was like, please just don't let me see anything I shouldn't see. But it ended up being all right. You guys were great, and you guys made my life a lot easier. So, it's everything kind of started. Initially for me, for my PT journey was an injury. I think a lot of people go through the same thing when they're starting going down this kind of field, because you don't really see what PT is like until you're submersed in it. And when you're a patient on the table, you're a fly on the wall essentially all the time and seeing how all these therapists work. So I had an ACL injury. I was playing soccer and ended up tearing it, had to get the whole reconstruction. And that's like a 6 to 12 month process, depending on where you're at. And so I was in PT for almost a year, seeing how people work. And I ended up falling in love with it. I was originally to be on track to be going into architecture. And after going through that whole experience and seeing how therapists work, I just was like, I really can see this being a great lifestyle. And after talking and doing research, it ended up changing my course of action from looking into architecture schools to then looking into PT schools. And that's how I ended up at Sacred Heart. So Sacred Heart in general was awesome. And it was a really nice transition. As you guys know, like that program, when I talk to other people, it's such a blessing to be able to just go from an undergrad to a grad position. And some people did it in 3 years. I think that's amazing. I went kind of the more traditional route with the 4 to 3 years. And then it overall just, I felt very prepared after we completed that program, because it was such a different kind of curriculum compared to, I guess, the traditional setting. So all that problem-based learning, it's like you're educating yourself, you're educating other people. I think that's the best way to learn. And after going through all of it, it just kind of enhanced my my interest in the field and like how much there is to know. I just feel like you'll never be bored doing this because you will always have something to learn. And I think I realized that in school, because initially you think, oh, I'm going to get my 7 years done. And, I'm chilling at this point. I don't have to do anything else, but it's actually exciting knowing that it's not just the 7 years and that you're always going to be doing something different. You're always going to come across challenges, and that's what makes life exciting. So I'm really, really glad that I got into this field, and it looks like you guys are in the same similar mindset, because you're doing things to help other people recognize what the profession is about. And doing a podcast is amazing, especially now, today's day and age. Things are becoming all digital. Everyone wants to learn on their own time, and doing podcasts like this. I mean, I listen to a podcast on my commute, so I'm sure there are people that really could get a benefit out of the experiences that you guys are or showing on your show. So that's awesome.
No, appreciate it. I think I really agree with the the problem-based learning. I remember when I was in it, I absolutely hated it. I was like, I thought tutorials, like, this is such a waste of time. Why are we doing this? It was like 6 hours a week of just presenting and listening, which is like, I never really gained as much from tutorial. And then it was like the other 8 hours of your week trying to plan for your tutorial. And then I get to tutorial, I still stutter like as if I never knew what I was doing. So it definitely helped.
Yeah, and the other you touched on, just like even after school and just like that learning piece, like you never, I felt like I never complete. Oh, let me read this article to figure out how to treat this, and then I end up with more questions.
Yeah.
So then I start reading more articles and then taking more continuing education courses.
Yep.
And I'm like, wow, this is that whole like I'm constantly learning, trying to like figure it out, and then like, all right, how can I connect with my patients? How can I do more? How can I be a better therapist? So it's like pretty rewarding to like kind of have that opportunity that, all right, everything that I look up, I can directly impact someone's life with it. It's been pretty nice.
Yeah, no doubt. I mean, I literally did it yesterday looking, because it's easy to fall into the trap of just let me do the least amount possible for patients. I think at some point, everybody comes across a day like that where you just need to get through the day. But the problem, I think, for me was if you have days that start to stack up like that, where you're having a tough day and it leads to another tough day, and you start to do a little less than you should be doing, or your standard, you're not upholding yourself to your standard, it's so easy to fall into that trap. And I mean, yesterday, like, I think our program prepped us to be better than just like that standard, because I think one of the things with getting patients educated, like you're saying, I'm pulling up research articles for them to read. I'm like, this is the stuff I was just reading yesterday. You should like just, even you like take this highlighted part and just take that home and look into it, because it's going to help them understand just like what they're dealing with a little bit more. And I think when people understand what they're dealing with and they see that you care, that to me and to them, I feel like has been the biggest difference, is that how much you care into your patient helps them tremendously. So I think our program really prepared us for that.
That was the biggest shift that I'm making between my first and second year. Was I feel like in my first year is like, all right, let me see what skills I can do to help the person. And I think after a whole year, I realized I was like, I have such little impact because I see you very little throughout your week. So it's like, if I can just even give you more education or articles to look at, I was like, that's probably going to do you better than me putting my hands on you or giving you like the magic exercise. It was like, at least just enhancing your knowledge on what you're going through.
Yeah, absolutely.
And then once you're like able to like educate someone on what's going on, like their buy-in is just that much greater. They're like, oh, you like, I see the process and this is how I can actively participate in my own rehab too. It's not just like I come to you for you to fix me. It's like, all right, this is like a collaborative effort.
Yeah, that's the first thing I'll tell people. As soon as on the first day we meet, within like the first 10 minutes, I said, I would love to do everything for you, but in reality, it's a team effort between you, me, the doctor that you're seeing, and together is how we're going to figure out the solution. It's a puzzle that we're trying to piece together, not just me trying to figure everything out for you. So
yeah, and that was
100%.
the biggest mistake I made first year. Was like, I thought it was on me to make sure that they had everything. But I was like, realistically, I was like, I can't change if they had bad night's sleep, if they drank too much the night before, if they just had a death in the family. So it doesn't matter what I give them. It was like, at that point, it's such a highly variable thing each day.
Yeah, that's the biggest thing. You never know what people are going through, and a lot of times they don't want to share the things that they're going through because some of it is very private, and we have no idea. We're just getting that person face value at that time. That is so true. And we oftentimes beat ourselves up as therapists thinking like, man, I'm just not doing my job well. Man, this person's not getting better. But in reality, maybe that person is going through a breakup and they haven't slept for 2 weeks. And at that point, it's like your body is nowhere near ready to start healing. So
yeah. I think one of the big things Pat does before his sessions, he says he always like just starts with breathing just to like even set that slate to be like, all right, let's open the body up for healing.
Dude, I love that. I love that. I think that's a big component of PT that doesn't often get addressed.
Right. And just like I'm trying to open myself up to interpret kind of like the energies around me. And so like if someone just seems anxious, I was like, all right, let's just take like a diaphragmatic breath. Let's just breathe for a second and just like let's just be in the moment. Because if your mind is everywhere else, no matter what I tell you, what I do, like you're gonna leave there and not know what just happened, because it's that teaching point. Like if you're not ready to hear what I have to say. It's like you can't actively participate in your own rehab.
That is so huge, man. I will say, I think you're doing a lot of things that therapists never think to do. And it's such a simple addition to the toolbox that you can give patients, essentially, because most of the time people don't take that time to just like recognize what they're trying to achieve or how they actually feel or whatever it is that we're trying to do to help them. And taking that second to breathe and like the diaphragmatic breathing, I think is huge because everybody is so stressed out, especially after COVID and the state that the whole world is in at this point. It's like, man, there's no better way to just be in the moment, take that time to focus in on what you're trying to do and just focus on some breathing. That's awesome.
What I thought was funny, I had a patient one time breathe. I was like, all right, let's just do some diaphragmatic breathing. She looked at me, she goes, this is what my insurance is paying for. I was like, oh, damn. I was like, even after all the education, I was like, some people just don't get it. I was like, yeah, they just don't want to sit there and breathe.
Well, you can't help everyone. some people may not be ready to like accept your help or your expertise.
Yeah, that's true. There's definitely, I think what you said earlier, Pat, about learning and honing in on somebody's energy. That is too like one of the hardest things to do because as therapists, it's so much more like you're saying, Ty, than just like what you read in the textbook or like the skills of interventions that you know, because most of the time you have to really be able to acknowledge what energy state that person is in. Are they in an accepting state or are they in a very defensive state? Are they in like a reluctant state, like you're saying, where is this really what I'm paying for to start breathing? So you taking that moment, I think, is huge to just like not necessarily psychoanalyze, but you kind of are psychoanalyzing everyone that you're working with. And you're seeing like which direction you really have to go in. And like sometimes the whole session might just be, all right, we're going to lay down. We're just going to breathe because you seem like you're extremely stressed and you can't even focus on doing an exercise right now. So that's like, I think the biggest key too in PT is like being able to almost mind read a little bit and say, all right, this is the direction we got to go in.
Right. And I think that's been what I'm figuring out now is like, it's okay that they don't do everything that you had them plan to do. It's like you just being able to switch on the fly and be like, all right, I see that you're highly stressed. You're in this emotional state. Your body may not be able to tolerate everything that I have planned. So let's shift it all the way down. Let's just probably do 1 or 2 strengthening, whatever. And let's just be in the present, be in the moment, and just be aware of what our body is feeling. And that's why I'll say, hey, let me know if you feel this, or this. That way let's modify it. Like, I'm not trying to always stress you to the max every time you walk in here.
Yeah, that's huge, man.
One of the courses I had taken that was pretty interesting. I was talking to Pat about that. It was like the whole continuum of care of what everything takes. It was like the biggest problem we have as therapists is you see the global scale of like, oh, it's going to take this long. You're gonna have to do this. You might have ups and downs, all that stuff. But it was like the patient only agreed to one part that they know of. So like whether it's movement wise, they agreed to, oh, I want to move better. I want to lose weight. But sometimes they don't take into account, oh, that means I need to work on my sleeping, my breathing, my thoughts. So it's like, for us, it's like, why don't you try and get the whole thing? But you realize like I have a global picture, whereas you might have a very specific, oh, if I just do this, I'll get to my end goal. So it's such a hard thing for us as I feel like therapists to be like, how do I meet you where you're at? How do I find like what your level of agreement is?
Mm-hmm. Yeah, that's a really like complex entire situation because every human is so complex. And then you're getting somebody the first time you meet them and you're trying to figure out essentially everything that led them up to that point. And you're like, holy cow. And the more you learn, the more you realize how much you have to deal with. Mm-hmm. And a lot of times it's very complicated and you're having to address all those different factors, not necessarily just what their range of motion is, but you're saying, are they getting good sleep? Are they eating properly? Are they having a very inflammatory diet that's causing more inflammation? Like my voice. But But all those things, like, you learn as you talk to them. I think that's the special part about our job. We get to talk to people for a good amount of time, as opposed to going into maybe a doctor's office where you're just talking to the doctor for 5 minutes, and you get to really get a feel for what that person's life is like, and then start to ask some of those life-changing questions, like, how was your sleep? And what can you do to make that better? Or how do you feel like you've been breathing lately? Those are things that oftentimes you never get addressed or ever even thought about. And when people come in, like you're saying, and have this little idea of, I just need to do this one little change, the more questions you ask them, the more they realize, holy cow, this might be much more than what I was anticipating. And a lot of times I think people are very happy to notice that and realize that it's not going to just be one thing, but that they're getting addressed holistically, and they're getting their whole body, mind kind of looked at to see where they can make improvements. I think that's where people oftentimes are very grateful when they start therapy, to realize that they're doing much more than just a few exercises and stretches.
Oh, that's huge.
I had this week, speaking to that point, that a patient, she just had an MRI. She had like a meniscus repair, and the doctor came in and kind of read the results of her MRI, but like did it so quickly and just in like scientific terms. And she was like trying to explain to me. I was like, I just don't know what he said or what this means. I was like, all right. So like I had the report, and I like just walked her through it in like layman's terms, and she was like, that's not what anything that he said. I was like, and he even like omitted some of the reports, and it was like, probably due to he didn't feel that it was important, but she wanted to know everything. Like, she's kind of really involved in her, like wants to be really involved in her care, and just like kind of wants to. And so, and she just like thanked me. She's like, thank you just for sitting down and just talking to me about what's going on. And so, and because she feels like she's getting pushed to like just get injections and things like that. I was like, well, they'll help treat the symptoms for sure, but it's not going to treat like the source of the pain. And this is, and then just talking to her about arthritis and things like that. I was like, there's only so much we can do, and this is not all right, let me get these injections and be done. It's like, this is how your body is, and just like trying to educate that, like, this is the body that you have for the life. You just can't change your anatomy. And she very appreciative of just like talking me through and just like getting a different mindset, and just like, all right, this is not just a 4-week thing or a 6-week thing. All right, this is kind of like a lifelong, all right, being awareness of what I'm feeling, what I'm doing.
Yeah, man, that's huge, with getting people educated from the get-go and throughout the entire process. And I think it's so hard for doctors, medical doctors, this drives me crazy, but you're taking an image of a person in one single shot of time, in one single position of their body, and then trying to explain their pain based on that one little bit of time in their entire life, where maybe they may actually be positioned incorrectly, and the muscles or tendons or ligaments or whatever else that's showing pathology is looking abnormal. The shot is just, it helps guide treatment. And I think that a lot of patients get very concerned about that, and they put all of their attention and all of their stress on that MRI, and then they come to us very stressed and worried. I think that's where we can be kind of that relief for them, to help them understand, like you're saying, what that image means, what it kind of entails in regards to if there is a serious pathology, if there's a labral tear, what that is actually looking like, or if it's just a minor tear, and that there could be a conservative treatment for that. So it's like having that, being that person for people, I think is the most important thing. And we luckily have that opportunity to be those providers and sources of guidance for people, as opposed to a medical doctor that just simply doesn't have that opportunity. they don't have the opportunity to spend as much time as we do. And I think it's hard to blame doctors for that because it's just how our medical system is, and it's very unfortunate. But luckily, we're still in a position to help people understand and kind of set the stage for what they are to expect. So I think that education component is huge for most people, for therapists, for doctors as a team with the patient.
Oh, beautifully said. Yeah, because that I believe is so true. There's a lot of damage control after they get an MRI, or someone I'll have come in with like low back pain, and the only descriptor is mainly that it feels tight all the time. And they're like, oh, I'm just going to go get an MRI. I was like, for what? Why are you getting an MRI? I was like, I understand you want to get it for your peace of mind. But I was like, tightness for me in the back, I feel like that's just going to be an unnecessary test that you have to go do. And they'll come back and they're like, well, I saw my doctor said that I have like mild arthritis at this. I was like, mild arthritis means you've been alive. I was like, you went to go get that just to get told that like your body's been on this earth.
Yeah, your body's going through that natural aging process.
But I think what's pretty cool in the education portion, I have a lady right now who she's a long distance runner. She came in pretty much and she was like, oh, I have shin splints. And I have a race this weekend. Do you think I can race? And this was like 4 months ago, or no, like 3 months ago. So we get her. I was like, her balance was really bad. There's a lot of things going on. And I was like, honestly, I was like, I don't think this is going to be like a right away thing. I was like, we have a lot of things that we have to address. And it wasn't until 3 months from now so her shin splints are gone, but now she's getting like a lower leg injury. But it's because her balance is so off. And then we come to find out that she had a couple like falls beforehand, that it was just totally unplanned. Talked to her doctor, everything was fine. But it then goes to show, she was like, yeah, I thought I was coming in here just for shin splints. I didn't realize. So now we realize she has like more of a vestibular problem. So she was like, yeah, this is an entire thing. I see how all of this is connected.
Wow.
That's awesome. That's awesome that you could that you're able to make people realize that. Because some people will be very reluctant to even want to look to see what other things they have to address. I'm just here for my ankle and I don't want to look into anything else. And I just want to get to my run. But the fact that you're able to help people and recognize that is huge, because most of the time it's like, just take care of this and I'm out of here. And if it's not done by next week, then I don't want to see you ever again. Yeah. So it's like, again, that all goes into patient education right from the start.
Right. I want to pivot more into kind of like what you felt going into physical therapy after graduation, and just like how the past 2 years have been for you.
Yeah, that's a good question. I think we went into the field at a really unique time in the world. It was like right as COVID was starting is when I started. So the job market was very low at that time. And it was not easy finding a job. I had to end up, like I mentioned earlier, was to start working in Connecticut, and I was living in Long Island. So my commute was roughly an hour. Luckily, at that time, there was no traffic. So it's changed a lot since then. And I think we're always adapting. I think that's what I'm realizing from the moment I graduated till now, is that you're always going to be adapting, whether it's the things you're looking for, the type of treatments you're providing, the research you're looking into, and your priorities start to shift. And you start to learn much more about yourself from the start. The moment you graduate, you think that you want to go a certain route. And as you start to do those things that you want to do, you end up actually in a different position. But I always say it's a good thing to do and put yourself out there, because this is how I felt. It's like, as you walk out and you start to put yourself in different positions, you have a different view of the world. Your whole paradigm shifts. My paradigm in Sacred Heart in Fairfield, Connecticut, was completely different of the world than it is now, because as you walk out, you just see things differently. You start to experience what the world is really about. And then you start to realize what you really want. And when you're doing something every single day, day in and day out, that is where you start to learn which direction you want to start heading more into. So it's been good 2 years. I will say, like, I feel very fortunate, very blessed that I still have a job. There are some people that got furloughed or weren't able to work during COVID, or just had a delayed start. Um, and there's also some people that just are not very happy with the position that they're in. And I feel very blessed because I feel like I'm working and doing the things that I love to do, and I'm I'm able to show up every day to give 100%. And I think some people, when they're not in their right setting or they're not exactly where they want to be, it's hard. It's really hard to give 100% of yourself if you don't feel like you're fulfilling kind of the passion that you're looking for. So I feel very fortunate to be able to say that right now.
Oh, nice. So you also talked about you started in Connecticut. What kind of clinic was that? I know you said it was like a one-on-one.
Yeah, so it was a one-on-one. It's almost like a little boutique clinic where we're able to see patients most of the time one-on-one. Actually, all the time one-on-one. It's just um, there's it's very niche. Like, it's very younger athlete population. We of course saw it was open to the entire general population, but a lot of younger athletes gravitated to it. And so I ended up working with a good amount of athletes just from the start, which is what I was looking for. I was really excited about that. And I was really happy. I loved it. It was, it was, it was a great opportunity. And that clinic is very niche. So it's like, it all depends. It wouldn't look like a normal PT clinic. I would hear this all the time. People come in and say, this is a PT clinic. It's like, it was very different. So, it was more just like a transition, not knowing how you see your colleagues do the kind of work that they're doing, maybe where they're working with 4 patients an hour or 6 patients an hour or in a hospital setting. I was kind of learning how to do a lot of customer service because it was an out of network place. And it was in a very affluent area. So there was a high demand, not a high demand, but like a very high pressure setting to perform. You know, you're with a person for an hour. You know, you can't really run away if you don't know what's wrong. Like, you have to figure out in that moment, you know, how you're going to help treat this person. And especially as a new grad, you know, there's going to be times where you don't know 100%, and you're with that person, and you're 5 minutes into it. Like, I have 55 more minutes to work with this person, and you figure it out. But that was a good opportunity to learn and learn with people.
Yeah, I feel like the new grad thing is tough. Like at the clinic I work at now, like the owner is pretty well known and everyone wants to go see the owner. So when they see me, sometimes they're like, oh, I wanted to see the other guy. And so it's tough because now you have to perform as much as they are getting the expectation from the owner. And some of the times it's tough because it was like, I don't have the skills that he has or the experience. I was like, I can give you the best that I have. And I think that was a good thing for me, just realizing, okay, you're not going to please everyone. So if you give them your best and it's still not good enough, it was like, that's not your fault. It was like, you gave them what you had. But if you cheated them a little bit and was like, gave them half the effort, that's when I would feel like kind of I wasn't giving my best self. So I stopped getting over the high pressure situation because I was like, that was stressing me out.
Right. And for myself, just realizing that though someone is different, like, you are qualified to be in this position.
Yeah.
So I was like, even though I can't, I was like, all right. At the first half of the session, like, I don't know what's going on. Like, it's like you're telling me this information in my head. I'm like, what do you want me to do about this? Like, right? Yeah. But then just like kind of like all settling into myself, like, hey, I'm in this position for a reason, like, and I can get through it. And it's like, all right, we can figure this stuff out together. And so that's been nice in the past couple months, realizing that, like, even though I may not be the shoulder guy, I know a lot about shoulders and I can get you better no matter what. And so that's been pretty nice. Though it might take me a little bit longer to figure it out. Like, all right, I think now I look at it like, if I do have an hour, it's like, all right, I'm glad I have the next 55 minutes to, to work and figure it out and work with it.
Yeah, I think we're always figuring it out. I think anyone who says they know it all is bullshit.
That's what I think too. I'm like, there's no possible way, because every time I learn something, like we said, I have more questions. I was like, how does this work that every time I learn more, I know less?
It's so true, man. It's so true. I think that's always a good way to gauge, to like see if you're with a good provider. If they're trying to boast that they know everything, that they're gonna be, it's 100% guaranteed. It's like run the opposite direction for
Yeah.
anything, for anyone, and
Yep.
not just in PT, but in general. If it's, I think that's where a lot of people bump into problems. So
Yeah. I wanted to ask a little bit about, because you had a pretty unique clinical experience. Did that, if you can speak on that and how that kind of helped you as a therapist, or maybe in your first year?
you're referring to Exos, correct?
Yeah.
Yes, that was very unique. I was very excited about that one because it was the field that I was really interested in with doing sport rehab. And that was one of the few clinicals we were able to get from Sacred Heart that was really sport oriented. So the one I was at was in Frisco, Texas. They were actually one of the clinics that held the NFL Combine prep. And luckily, that during the time that I went, they were doing the NFL Combine prep. So it was around like November ish, in around the winter. So most of the patients that we were seeing were collegiate athletes prepping to be in the NFL, and it was awesome. Like these were some of the, like some of these people were just absolute freaks of nature. You just, at some point you look at them, you question how they're doing the things that they're doing, especially from a PT mindset. You're just like, how is this person moving the way they move, and performing the way they perform based on the things I'm seeing? It just, sometimes it never added up, but it was I was really happy with that experience. And after going through it, it kind of shifted my direction because I've always been interested in more of the athletic population, and I thought I wanted to get into professional sports. But after seeing what it was like, I didn't really find myself like full of like that passion I was referring to earlier, where I like wanted to be immersed in that 24/7. I enjoyed it and I had a great experience. I don't regret doing it. Just, it wasn't the lifestyle that I wanted to live moving forward after that. And as a professional sports physical therapist, you are like on call 24/7, most of, all day, every day. And you're traveling, um, you're never really home. It's kind of like in season and off season. So I'm glad I did that experience. It just wasn't the direction that I wanted. This is what I mean. Like you live and you learn as you go through these things. It wasn't the direction I wanted to keep going in. But it did make me realize I do like working with the athletic population, just not on that level. And that's a very intense level. I think certain people and therapists are cut out to be in that position a lot of times. Maybe that might change in the future. But coming out as a new grad, I just wasn't the thing that I was looking for. But it was a really, really cool experience.
Is there any like way of thinking or techniques that you pull from it that you still use today?
Yeah, I use a lot of the techniques. Like, so Exos has its own education platform. And if you go on their site, they have education for everything, for PT, for training, for nutrition. So they were kind of approaching not the therapist, but the patients from that holistic point of view, where they're looking at all of those different aspects. They have nutritionists on staff. They have doctors on staff. They have massage therapists, PTs, of course, trainers. So they're treating the person from every angle, and they have a lot of that information for the employees. So before I even started, I had to complete courses, and those courses were educating you on the kind of exercises that they do, the kind of movement prep, their system, how they go about like treating the person. It's very systemic in the way that they do things, and it's actually very impressive how much material they have for people to use. And it's not just for the employees, like you're able to get those courses online. I think you have to just pay for them, and they really help from every aspect. If you're just a trainer and you're looking for more information on how to help like that type of population, they have that, you know, material on there. So that material I will sometimes revert back to, I'll use, and a lot of times that was what everyone was using. It's like everyone was kind of speaking the same language. It was really impressive to see. You know, you go into a normal clinic these days and everyone is a doctor in themselves. So everyone practices their own way and kind of speaks their own language. But at Exos, it's like everyone comes from a similar education standpoint that they've developed, and they all write and speak the same language amongst each other and their techs and the therapists and patients. So that was the most impressive part for me, was that they were able to develop that kind of system. And so I still carry forward a lot of the things that I learned from there into like my daily practice. Is just not exactly, you know, now it's taken a different shape into the newer experiences that I have to kind of create the, you know, the person that I am now.
Yeah. So what did your day-to-day look like with all those other things? Because I'm trying to think, if you have, like, where does a therapist fit in? If you have a strength coach, but you also have a massage therapist, but you also have like the techs, like how do you fit in that puzzle?
So they have, when the patients are there, so for the combine prep, the athletes have different sessions. So they have a block time for each thing. They'll have a morning session for training and they'll have an afternoon session for training. In between those sessions, they have PT time to come in, get scheduled for PT sessions. They also have time for nutrition and eating. So not everyone is getting treatment at the same time. Not everyone's training at the same time. So maybe the first half of the group, I think we had 40 athletes at the time. So probably they split up to 20. Each group was doing training. The other 20 is probably getting PT, or maybe they're doing their nutrition for that first block and then doing PT. So it's kind of like, it's a living, breathing schedule that they're adjusting every day. And they're kind of getting passed on between all the different disciplines so that they can get, you know, the treatment that they need by the end of the day. And some of the days for them were from 7 a.m. till 8 p.m. or 9 p.m. And it's a long day, but that's like their job essentially. So they oftentimes end up getting hotels that are right next to the clinic. They'll sleep right next door, walk over, and the next day they're kind of redoing the same process for a few weeks. So it was a really unique thing.
Yeah, you had some pretty big names I saw that you were treating. What was that like? Did you get kind of like that imposter syndrome, or feel like you had a pretty good skill set beforehand?
No, you definitely get imposter syndrome, but luckily you're working with a lot of people. So you're not just by yourself in this setting, because of the type of athletes you're seeing. It's like those are big names, and a lot of times you're getting help not just from your colleagues as students. Like you have 2 or 3 students that you're working with very closely, and you also have a therapist that's overshadowing everything and making sure that things are under control, as well as a director and of course the trainers. And it's really a team effort. Like, I'm working hand in hand with the trainers when my patients were doing their strength block, because at that time is when I can really see the way that they move without them knowing that I'm watching them. So some people kind of change the way that they act or the way that they move when they know they're being watched. In this setting, it's like I get to see naturally how they're actually moving and make those adjustments in real time for them. And we do that specifically with the trainers. So it's like the pressure is not as intense as you might anticipate, because you're working constantly with all these other people at the same time with these athletes, and you get so close to them. And again, they don't, I think Pat, you said earlier, it's like, you know what you're doing. It was one of my last clinicals in your third year. And like, you know, a lot of information. You just spent 2.5 years in school learning everything and applying, and that stuff was, I felt very prepared to do when it came time to actually treating. So they ease you into it. Of course, they're not just like, here you go, here's a whole caseload. It's kind of like, here's this patient, let's kind of go through this. And then you learn along the way. And then by the end of the thing, you're seeing all of them and treating them, and they feel comfortable with you. And it was smooth. Like I didn't have a problem, there were no athletes that felt like, oh, I don't want to work with the students. They also recognized like they were kind of students themselves, you know, they weren't in the NFL yet. So sometimes it's good that their ego wasn't at that level yet, but everyone was very nice. Like even the athletes, sometimes you might anticipate someone like, oh, I don't want to work with a student, but they were very open to that because everyone is so reassuring for them. So.
Oh, nice.
How was the collaborative piece between like the strength coaches, and like how often do you talk, and how could you adjust different things like on the fly?
Yeah, it's really seamless. Like I wasn't participating as a student in the roundtable discussions, but they have roundtable discussions every week on each athlete individually, and every discipline is talking about what they're seeing and where they need to make improvements from their end. And there's that constant communication, as I mentioned, on the fly, like whether they're on the table and I'm treating them and their trainer comes over and says, hey, are they going to be able to do their skill work today because of their hamstring, or are they not? And at the same time, if they're doing their skill work and I see that they're compensating or that they're not moving as fluidly as they should because maybe their ankles look really stiff or their hips look really stiff, I'm able to pull them out during that session and address the things that they're feeling immediately. That to me was like what's really incredible about what they're doing there. It's like everything is real time. Everything is kind of like it's tailor made to every person. As many people as they have, every treatment is really tailor individualized treatment. So it was really cool.
It makes sense because if you look at, I think after every draft, when I see it's like how many of them were Exos athletes, I was like, it's crazy when you see how many people go through the like Exos system and then end up getting in like the first round or even just drafted in general.
Yeah, they do get a lot of they get a lot of draft picks. I see it too. It's like I don't know if there's any other program that competes at that level. There's definitely other programs in that area that I know other athletes have gone to, but I don't see the numbers that they're putting up as much as Exos does. You bring up a really good point.
Yeah, it was really cool to watch because I've used some of their educational stuff. But then I just kind of want to talk about what you do now. So you worked at the one-on-one clinic, and then now you said you work in Westchester.
Yes.
So what is that kind of looking like?
So it's similar in the fact that I'm still getting one-on-one time, but I don't have the one-on-one time for an hour. I have 30 minutes with that patient. So a patient walks in the door at 9. I work with them from 9 to 9:30, and from 9:30 till roughly 10, they're doing their exercises with our assistants. So our assistants are guiding their treatment. It's a big open space. So although the assistant is guiding them through that treatment, I'm always keeping an eye on them, making sure that if something seems off or if they're not feeling like their exercise or stretch is benefiting them, I'm able to make that adjustment on the fly with them. And so even though it's not that one-on-one, it is a little less intense than that. And I'm able to see almost two people, not simultaneously, but if I'm working with somebody on a table, I have kind of a bird's eye view of the floor and I can see how my patient is doing with their exercises periodically. Now, if I see, I'm not going to watch them do 3 or 4 sets of that exercise the entire time. But if I see that first set, something looks off, I'm able to make that correction even as I'm treating someone else. So I like that aspect that I'm able to get that hands-on time with patients for that first 30 minutes or education time or whatever it is that they need, and then have them transition to just doing their exercises. And there's other times it's not set in stone with the treatment. Looks, it's always changing for everybody. So they might spend an hour doing exercise. I may be doing 30 minutes of exercise, and then they continue doing the rest with the assistant. So it's been it's been really good. I like that model of having the help, because when you're one-on-one, you don't have a PT tech to help you. It's just you. Here it's a team effort, and you're able to see more people, you're able to help more people. And to me, that's like the most important thing now, is being able to help as many people as possible who need it, because there's so many people that could really take advantage and improve their lives through physical therapy. And I think sometimes it's hard for people to get that access to the care that they need. And if we're able to provide more care for more people, that's just like ideal case scenario. So it's been good where I'm at now.
That's what I find a lot of time. People actually are, as much as we joke, I was like, people actually are really, really grateful of knowing the information that we know, or like just having someone sit down with them and be like, listen, I know you might have been told this, but this is probably what's going on, or this is more likely why your situation is the way it is. And like, at least just getting an honest, down to earth rationale. I feel like people are really grateful. And I've had people where if they're still complaining after so many months, and then when we do a progress note, they're like, oh yeah, it's like, it's much better. I just want to complain that day because you're that outlet that I need, or something like that.
Yeah. No, we're always, if we're not just physical therapists, we're psychological therapists too. So
Yep.
Right. I had a patient just come in, who walked in, and then just like start just spewing like everything that's going on in her life. I wasn't gonna shoot, and then she stopped and she was like, I wasn't gonna say any of that. I don't know why I did that, but thank you for listening. Like, all right, whatever makes you feel better. Like, we're here, we're doing it.
Yeah. Hey man, that speaks volumes to the fact that people feel comfortable enough to say that, you know. It's another thing if somebody just comes in and they're super mute and closed off because of the type of energy you give them. So it's good that you're able to make people feel that welcome. I think that's a big skill of any physical therapist, is being able to have like that communication and make people feel comfortable, because if not, it's going to be a very awkward 30 to an hour minute. You know what I'm saying?
Yo.
Is there a specific population that you're looking into learning more about, like how to treat?
I do look more into the sport athletic realm rather than the geriatric or neuro or lymphedema type of realm. So it's definitely more tailored to that kind of like person that's looking to move better, have better quality of movement, with whether it's just in their garden or if it's on the sport field. So it kind of ranges. I'm not really looking to niche into like just football or just basketball or anything like that, but that's what I mean. I want to help people feel better about moving more. So any person that's looking to actually be some type of athlete, and like, again, it's not just a professional athlete, but if you work in a garden, I consider that an athlete, because that's a lot of work and strain that you're putting on your body. So people that like to move are the people that I like to help. It's the people that don't want to move and don't want to do anything. That's just like, I'm sorry, but you're not, I can't help you, because it's just not this, I just can't help. It's not my passion to help you. So
like, you don't want to help yourself. If you don't want to help yourself, how am I going to motivate you? But I agree with that. I think everyone's an athlete in their own sense. And it's like, a lot of people don't give themselves as much credit. I was like, getting up and going to work is one, that's a commitment every day. And then anything that you do on top of that, whether you have to go run and grab the kids and do something there, I was like, that's an athlete, and you're putting yourself through constant stress, whether you think it's stress. I was like, even getting in the car and planning to get these things and drive through traffic, and now you have to go sit in the bleacher unsupported. I was like, that's a lot of stabilization required. So that's an athlete, even if you believe it or not.
Yeah, there's no doubt. Just being a parent, I feel like, is hard as hell. Sometimes harder than being a pro.
Right. I think right now I'm really interested in trying to learn how to like strength train and just more so train patients like 65 years and older. I was like, I probably like the people that like that's been on my schedule lately that just like feel just like overall just weak. I was like, all right, let's get you stronger. Let's move.
Load that.
And so now
Yeah.
things that I'm like Googling, just trying to figure more out. It's like, all right, these older patients that I have, like, how hard can I push them? What can I do? What kind of precautions do I need to take other than like, all right, let's send it. You know what I mean?
Let's get you under the bar. Let's get you under the squat rack.
Like, what guardrails do we need to like set up so like we are going like this direction? Really?
Yeah.
That's kind of like man. Where I'm at now. It's like, all right, how can I get these people strong? Let's go.
That's interesting because then you always see like the videos on Instagram of like a grandma or grandfather lifting like 225 or 300. I'm like, all right, if you can do that, I was like, I'm pretty sure my patients could do something.
Yep. Yeah, I think there's a lot of potential to that question, Patrick, because like you're saying, Ty, there are people that are significantly older than we are that are probably lifting a lot more weight than we do. And it's like, it's crazy to think, but the body is really capable of doing so much. And I think about it all the time. It's like, we have people that are setting world records of lifting over 1,000 pounds. And it's not to say that I'm going to be that type of person. I'm going to make my patients do that, but it's just like, that's how much potential we have. And it's just prepping people to be able to do the things that they want to do. So, you know, there's really no limit. I think even as we get older, I think there's such a limited mindset, like scarcity mindset of, oh, I'm older, I can't really lift much anymore. It's like, we're the people that are going to help change that mindset for a lot of those people that just are afraid to do anything anymore. So,
yo, Eric, I have to say, and I got this from you. I'm reading a book called The Brain That Changes Itself. And I got it from you because you posted it like a couple years ago. I screenshot, downloaded it, and I was listening. I think it was like 2 years ago I started listening, and I don't think it hit as close to home. So I like kind of paused it, and then I restarted it recently. The book is freaking wild. Like,
it's insane.
And that's what I tell
absolute insanity.
All my patients pretty much. I was like, you don't understand. I was like, they had a lady, the first chapter talks about how this lady was blind and then they taught her how to see using her tongue. And I was like, that in and of itself for me, I was like, that was my buy-in. So I've been trying to use a lot more of the neuro aspect with those types of people. The other thing I saw was there was like a mouth guard or mouthpiece that went pretty viral on like Shark Tank. And it was a weightlifter, and he was like, oh, it helps you increase like your tone when you lift. I was like, what is he talking about? I was like, it's just a mouth guard. And now I'm starting to see more and more like how powerful like certain things like your bite is, or why people clench their jaw all the time whenever they're stressed or anything like that, to help with like the tone for if they are gonna like fight or flight. Feels like that clenched jaw gives them more of that tone. I was like, it's just crazy when you look at all of that.
Yeah, when you can look at things like you're saying, the neuro aspect in an ortho setting, I think that's such a big separation in care, because a lot of times people look at it just from the musculoskeletal standpoint. But in reality, like you're saying, your tongue position in your mouth can change completely how you move, and vice versa. How you move your eyes in relation to your head and your body can change your balance. So it's like all of those things, when put together, can provide such a positive outcome for people. And that book was really amazing to see, because it opens your eyes to things like that you just never would think would actually be correlated. There's this other doctor that really gets into that. His story is about he had a spinal cord injury, and he was able to rehab and essentially heal and regain all of his function through meditation and through those different kind of techniques with your brain and everything else. And it's really amazing how much power and potential your brain actually has. It's just like, how much of it are you tapping into? And it's like, the more you learn, the more you realize it's limitless.
Yeah. Is it Joe Dispenza?
Yep.
Yeah. I read a couple of his books. I just finished Breaking the Habit of Being Yourself. It is a wild story. His backstory. Insanity,
right?
And I had a patient. It was funny. So I had a patient come in for an initial eval, and he was late. And then he was talking about like, oh, I have the power to heal myself or heal a bunch of people, but I can't heal myself. I was like, what are you talking about? And then he was like, oh, look up all these books on energy. And then I came across Joe Dispenza, and that was like about a year ago this time. So like I started doing all those meditations and all those practices, and I didn't know it was because he was like hit by like a bus or something and had a spinal cord injury. And he just like thought about every level of his spine every single day. And it was like, okay, if I mess up, I'm going to restart again. And that's how he ended up being able just to walk him. Like now I think he still runs.
Yep. I think that's amazing. That's what's so incredible and what makes everything so much more interesting. It's like you have that power to change that. It's just through your thoughts and your mentality. It's like, how, if you can do that, like think about how much more you can do, you know?
Exactly. And I think that plays into the big thing that I've been trying to implement a little bit more is like the motor imagery. They taught us a little bit in school, but I don't think I really understood the concept. I saw they did a study not recently, but they had a group that played piano, like actually played piano. And then another group just imagined the thoughts of them playing piano. And then when they retested like a couple of months later, they found that they had significant changes in the group that didn't play piano, but just thought about it. And it was like, that just goes to show in and of itself, like how powerful that is.
Right.
Yeah. I just read, or I just heard a podcast about that too. That said, it's like the results were so close to one another that practicing mentally is almost as good as physically practicing in real life. And that's amazing. That's how powerful the mind is.
Right. And that's like goes back into athletes. They do that a lot. So as a football player, it's like you think about how the game is going to play out. You imagining, all right, if this happens, then this is how the play is going to go. So it's like you're constantly training your mind every single day. The amount of thoughts that you put into something, and which on the other side of that, negatively, you're always having these negative thoughts. You're just feeding into that, and you're training your body to respond negatively, which is like a crazy thing to kind of put into thoughts, or just like realize that your mind and your body has that much power.
Yeah. Just the awareness of knowing that you can help guide your brain into doing the right things. If you know that what you think about is essentially what will happen, you have those negative thoughts about your rehab, that's probably how your outcome will be. If you have a positive result or a positive outlook on how things will play out, that's where you can actually see people make those positive changes. So a little bit of it is a little brainwashing for people when you're first getting started with them. And like as therapists, if you know that the way that they think about things is going to have an impact on their outcome. If you can brainwash them to have as many positive thoughts as possible, I think that's where you can actually cause a positive impact on their overall care.
Yeah, I had so I learned a new technique recently that it was, so say you have a person come in and it's like, how confident do you feel like you can get this, say it's your knee, we can get your knee rehabbed. You say 0 to 10, and 10's being like, I feel absolutely confident that you can get this done. And 0 being, I don't have any confidence. So, or whatever your question may be, say they give you a 6. So like, I feel like a 6 confidence level out of 10. The traditional way of asking is, why don't you feel like you're at a 10 or an 8 or anything like that? They said in reverse, ask, why are you at a 6 and not a 2? So that way they're forced to think of what the positive things are that make them that 6 level, as opposed to saying I'm a 2. So it's a lot of like you said, the brainwashing. Because if I just flip that question and say, why are you a 6 and not an 8? They're more likely to say all the negative things. And now they're ingraining that in their mind. And then they talk about like neuroplasticity is just a thing. It's like, it's not bad or good. It's just what you make of it. So then even taking those questions and be like, okay, how do I make this more of a good, as opposed to making it that negative portion?
Yeah, that's huge. That is so huge. Like that, you just like gave me chills, because that is, I'm not joking. That stuff that's what makes people better. It really is. It's the questions that we ask patients and how we frame them and how we get them to start thinking. Because if they come in and you're just pointing out all the bad things that they have, all of the things that could go wrong, or saying, oh, why are you only a 6? Why aren't you an 8 or a 9? Like, you should be more confident in my skills. Like, I'm the best therapist. To them, that doesn't reinforce a positive outcome. It's just that is so important for people to like know and understand. So That's a really good point. If you can carry that forward, I think it's good for me to just hear. I've heard that before, but like hearing it again, it's like, I wish I heard that before I saw every patient, because it's like, it can be so
Yeah.
impactful.
Yeah, 100%. Especially when it's like the longer days too. You're like, damn, I'm just trying to get through this treatment. I want to go home. I'm
Yep.
hungry.
Right. And
Yeah,
then
man.
also on the when you are tired and you're not thinking about
Yeah.
that, and it's like sometimes I catch myself. I was like, all right, we got to get your glute strength stronger. Or like we got to get you stronger. And then I was like, then I remember, let me say something positive. I was like,
Yep.
you've come a long way. And I was like, I'm proud of you. Like you
Yes.
are making progress. Like, and I try to end all my sessions like, all right, like you're doing the things, like keep at it. Like you're doing great. Like
Yes. Positive reinforcement.
just end with positivity. Even if they're not like seeing change, it's like you're on the right track. Like you're trying to figure it out, and this is what we're gonna do if we're gonna continue to go down this path.
Yeah, man. That's awesome.
The worst part about it is it's tough for us and them to have the kind of agreement where sometimes you not seeing changes is actually a positive for me, because I know now what doesn't work for you. It was like, for me, that's good because I'm taking away one path that I thought, so it makes it easier. But for you, you're like, damn, you just took 2 weeks to figure out that this wasn't going to work. I've been paying this money. I was like, it's a hard part of the job. But I was like, that's kind of the disconnect. And I think if we can get people on that level to be like, I should understand that not every session is going to make me feel better, that sometimes I might feel, I don't want to say worse, but sometimes I might feel exactly the same.
No doubt. Yeah. I say that all the time because whether people know it or not, medical doctors are doing the same thing. When you go to a doctor, you're getting a diagnosis, they're going to give you a medication that they think is going to help you. Most of the time, it might not. Most of the time, it might. You don't know. It's really a test trial, and everyone's making their most educated guess on what's going to help you. And if it doesn't work, it's fine. It's like, just like you said, you're learning what doesn't work, and you just ruled one thing off of the table to get you that much closer to actually figuring out the solution. So I say, no matter what, that's just how it is. It's almost impossible to know 100% of the time that we're going down the right direction. So,
oh yeah, that's the thing that I have in my head whenever people ask me, what do you think is going on? I was like, there are a million possibilities. Like, I have no idea, but I'll give you my best guess.
I was like, where do you want to start?
Yeah. It's true.
Like, what could I get done today? I was like, shoot, there's about 1,000 things going wrong, but at least let's try and get one of them today.
Right.
Yeah.
Let's knock one of the threats off the list. And that's one of the big things for me, that's been helping how my own rehab, and then with other people, is the way some people with neuroscience look at it as a threat bucket. So it's like you have the overwhelming bucket of whatever you like, say, take your body or your life. And the more that you pour in, your body can withstand some of the stress. But if you keep putting on stress, something's going to be an output. So whether that's pain, whether that's so chronic pain, nausea, vomiting, anything like that. So for me, it's like, okay, I may not be able to hit the one thing that brought your knee in, but maybe I can reduce some of that threat to maybe now help you sleep better, help you breathe better, help you move in something else. So that way, now maybe that's why your knee was bothering you, because it was just the output of all these other factors. So for me, that's kind of where I've been like, let me stop looking structurally at what exactly is going on. Well, it's still going to do that. But at the end of the day, be like, with my treatment, it has to be a little more holistic if I want this one thing to get better.
Yeah. Especially if you're addressing root cause, right? Like, you can always make someone feel better. Put a hot pack on, put some stim on.
Yeah.
Rub their leg. They're going to feel amazing. But are you really treating the root cause by doing that? And that's where you look into all those different things. And it's like, holy cow, man, if I just breathe a little better, I take some stress off of my rib cage and my back feels better. It's like, holy shit,
Right. That's what
like, wow.
This is why we're doing some breathing exercises.
Yeah. It's true. It's so true.
But that, and I think I had a couple of good, for me, it's been nice. I've had some more aha moments with patients, as opposed to like anything physical, more so. So now I have a lady coming into me for vestibular problems. First, she was coming in for neck pain, and come to find out, again, back to these vestibular problems, where she's like, oh yeah, I get seasick a lot of the time. And like, for me, that now I realize, oh, that's probably something to do with your vestibular system. And now realizing she has so much stress in her life, that she's like, yeah, but I just kind of like doing these things because it helps me like not think about the stress that I have. So she'll plan parties. She does all this stuff to kind of mask it. And I'm like, you have to really sit down with yourself and decide what of that is the most important. I was like, the more that you stress, the more these vestibular vertigo symptoms are going to come on. And so I had her sit down. I was like, read this article with me. I just like even pulled up the title of the article, and she's like, you're right. I need to fix the stress levels that I have. So I was like, that in and of itself, forget the vertigo, forget the neck pain, anything like that. I was like, if she can take that forward for the rest of her life to be like, my stress levels will impact my body in some form. I was like, that for me was all I needed in that session.
Yeah, man, that is powerful stuff.
So it's pretty nice for me now. But what's your path looking like, Eric, for your focus? Are you looking into anything in particular?
Yes. So you guys are actually going to be one of the first people that know about this, but I'm looking to actually get started to do more virtual care. And a lot of that virtual care is going to be through a website that I'm going to launch pretty soon. So I'm building that out right now. Some of it is going to be focused on, like you guys are already mentioning, all the stuff about like just helping people feel better from an entire whole standpoint, addressing those little things that oftentimes people don't know to address, managing stress levels, hydration, sleep, nutrition, but also from the physical therapy standpoint, as well as a training standpoint. So I really want to like create an environment where people can get that kind of care that sometimes we're unable to provide, even as therapists, where we might be short because the patient might have maybe 5 or 10 visits from their insurance to get as many PT sessions done. And you kind of have to prioritize their range of motion because they just had surgery, instead of addressing all those other factors that actually help them transition to a fully functional life, where it's not just, all right, let me get you out of pain and your normal range, but how do I get you from finishing PT to doing all the things you want to do comfortably with a lot of strength and confidence. So that's what the website is really going to be intended for, to help that transition between PT to your daily life and having the guidance to do that. So I'm doing that simultaneously. I'm still working a full-time job with ONS. So it's I don't plan on leaving there anytime soon. So we'll see. With today's economy and today's day and age, anything can change at any moment. So hopefully there will be no furloughs or anything like that. But that's the thing. We're always adaptable, and luckily our profession allows us to do that. So I don't think PT is going anywhere in general. I think we're going to be here for a very long time. It's not like some jobs that are kind of getting outdated or getting replaced by robots. I don't think a robot can do what we're doing, even if it has all of the information. Like we said earlier, you could have all of the answers, all the right, knowledge and skills to intervene. But if you're not acknowledging someone's energy and realizing where they're coming from and taking all of that into consideration, the person just won't get better. So I think that human aspect will never change. And it's really, really reassuring that we kind of got into a field that will be here for a long time.
Oh yeah. People will forever be in pain. No, you are not escaping that pain. So you need me.
It's kind of sad, but true.
Yeah.
But thank you, Eric, for joining us. I appreciate it.
Thank you, guys. I appreciate it. Thank you for having me.
Of course, we're gonna have to chop it up again soon.
Where can people find you? Like social media?
Yeah, social media. Just at Dr. Eric Bialczak, and then for the site, it'll be www.therastrongpt.com.
There we go.
Cool.